Hey, it's Michelle Neske, PA school admissions expert and the Posh PA. Today I'm going to show you a little bit of a different video. I'm going to be doing more of like a day in the life of what it is like for me to be in an outpatient oncology clinic. So I just arrived at work today, so I'll take you on a little tour inside and talk to you a little bit about how the day typically looks for me. See you inside.
Okay, here we are walking into the clinic. Now this is a building with multiple clinics and floors in it. Mine is on the first floor, and I enter through the back employee entrance and down the halls for patients. As you walk into the clinic, you will see the area for labs and vital signs. And then this is going to be our standard clinic room, pretty standard with the table, chair, computer, all the tools we need right there. And as you walk down the hallway, you'll see where our lab technicians are who run all the blood specimens. And as you walk down the hallway, we will get towards our infusion center. The infusion center is where patients go to receive any IV treatments they may need, whether those are anti-cancer treatments, fluids, whatever it may be.
Hey.
This is our workroom. This is where I sit, the NP, the MA, and the physician. It's where we do all our charting and documentation and eat lunch.
So this is your typical clinic room. This is where I see most of my patients, and sometimes in the infusion center where you saw before. And here is where I really discuss with them what symptoms they're having, how they're feeling, what treatments they're getting. We review what is happening with their blood work. And I really see a variety of hematologic and oncologic conditions because this is a community oncology practice. So that means I see a lot of benign hematological conditions like iron deficiency anemia and B12 or folate deficiencies, but we also see some cancer related, both hematologic, so blood, and solid tumor disorders, right? Anything from lymphoma to chronic leukemias to breast cancer, lung cancer, and all of that. So we have patients from a variety of different backgrounds with a variety of diagnoses, which really keeps me on my toes. So I got to use this computer here. And also just to be able to get to know them, develop a relationship. I'm often seeing these patients every 2 weeks, every week, every other week, especially if they're on active therapy. So it's really important to assess their symptoms and be able to treat any issues that they're having, make dose adjustments if needed. And then we also review imaging studies and any scans or reports that are going to tell us how their condition is progressing or improving, and we'll review those as well. So this is where I spend a big portion of the day.
Okay, so the patient journey is they check in, they come, they get weighed. We have a pharmacy window right there for any outpatient medications. And then they get taken back to the area where their vital signs will be taken, and then their blood will be drawn right there and sent to the lab for analysis. And then, of course, they get roomed to wait for a provider.
Okay, it is lunchtime, and if at all possible, I like to get outside to stretch my legs, breathe, get some fresh air, recenter and focus for the afternoon clinic. It just sets my mind at ease and really allows me to reset and be ready to go.
Okay, so here we are in our infusion center. As you can see, we have chairs, we have beds, we have our nursing station, we have our pharmacy, and this is where our patients will get treated. And we can come down here as we are very close, obviously in the same building, down the hall, and go right out here. And then we are back into our clinic area. So there you go.
Patients in the clinic room, we are very nearby to the infusion center, as you saw before. Now, oftentimes we'll see patients and send them down there for their treatments, which could be chemotherapy, immunotherapy, blood transfusions, iron infusions, whatever they may need, even sometimes just IV fluids, right? Not every patient goes to the infusion center, but it's right there when we need it. So the patients will see us and then go get their treatment. Now, we are very close to the infusion area, so if there are any reactions or emergencies, we can get there right away. So one of the things I do is help manage infusion reactions when they happen. The nurses are very well trained on how to do this, but myself and the physician are also on the premises, so if we need to run down there and help, we can. Okay, well, that is a wrap on another clinic day. It was a good day, busy but great. One of the things I get asked a lot is how many patients we see per day. Probably depending on the number of providers. I see anywhere, like today I saw about 20 patients. So it just depends. We have a nurse practitioner, a physician, and myself in the office. Not every day, so it really depends on how many providers we have on that day. But generally, that's about how many we see. So, hey, now that I'm done with clinic, gotta head home. I have about a 30 to 40 minute commute. And then the work really begins because I got my daughter at home. I got to make dinner. My husband is a surgeon, so it's always a busy evening, after school activities, all the things. So I will see you guys again tomorrow.